Hi, my name is Debbie, and I am obsessed with all things to do with ultrasound. I'm an empty nester who has spent the last 28 years scanning in all different kinds of situations: clinics, hospitals, point of service, emergency departments, private offices, echo, vascular, general, high risk OB, and want to dive down deep into all things to do with technology, techniques, and transformation. It's time we take ultrasound to the next level. Think of this like your little power boost on your commute to all things ultrasound, along your way to the thing that we call work. So pull up a seat, make sure you're comfy, and be ready to be challenged and encouraged as we learn it's all about the frequency. Please help me welcome Chad Leimkuhler. Thank you, Chad,
Hello.
for coming on our podcast and talking about point of care ultrasound today.
Of
Chad's
course.
got a lot of experience. Tell us a little bit about you and your experience.
So I'm a registered sonographer, registered in abdomen, OBGYN, neuro, and vascular. Um, been doing ultrasound for a long time, started out, worked in a few hospitals, and then I've been in the commercial ultrasound business for close to 25 years now. 20 of those years I was with GE, and over half of those years I worked in the point of care business. And then most recently, I've worked for a couple of handheld ultrasound companies. And yeah, so it's really exciting to me, and it's challenging, but also fun. And kind of a newer space, I guess. That's not as new as what it used to be, but
Yeah,
still,
I
still
remember when
fun.
point of care first came out and there was so much controversy, right? And so I think it's important to remember that anything new coming out, there's always controversy around it, you know?
Yeah, yeah,
So point of care came out and everybody was like, well, who's going to be doing it? Are they going to know what they're doing? And blah, 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 blah. And I think it just opened up a whole new world for
yeah.
teaching and education and opportunity, you know?
Yeah, back then, like 2007, 2008 timeframe, it was different types of physicians outside of radiology wanting to use this technology for different procedures and things like that. Of course, needle guidance, but vein closure, breast biopsies.
Right.
And then when you had the emergency guys want to start using it, that's when radiology was like, hold up, this is our space.
Right.
And the
Right.
emergency room physicians said, hey, these are things that you wouldn't want to drag an ultrasound machine down to the emergency room for. Like, we can just do these simple procedures. They don't need to necessarily go into the PAC system and things like that. And now I think they play well together, and they do store the images on the PAC system, and they have their own CPT code. So it's come a long way.
Yeah. So tell us, where is it most commonly done? Where do you train people to have it done most commonly?
Um, it's almost easier to say where we wouldn't be. So, point of care is literally possibly in every healthcare space, outside of cardiology, radiology, and maternal fetal medicine. So, inside the hospital, critical care, ICU, anesthesia, emergency department, pulmonary, I mean, you name it. Outside the hospital, you have ambulance services, helicopter services, you have sports medicine, professional sports teams, or, in the orthopedic clinics, you have endocrinology looking at thyroids, you have urology looking at kidneys and prostates. And all of this is considered point of care because they're not sending you out to the radiology department or cardiology department to get your ultrasound done. They're doing it while you're right there. Lots of procedural type stuff like PRP injections in that sports medicine and orthopedic space. thyroid biopsies, breast biopsies. So lots of areas outside like that. Also, military at the VA, any of these areas I just mentioned in the VA system, the DoD, these guys carrying them with them while they're out in the field or in the helicopter or something like
DOD
that.
being, what's DOD?
Oh, Department of Defense.
Yeah, that's what
So
I thought you
any
were
of the
talking
military guys, special operations and things like that. Even cruise ships. Like if you put a handheld or a laptop ultrasound on a cruise ship, like we were told it costs like $10,000 or more to turn the ship around and go back
about.
because someone has like possible gallstone or something. Whereas if they can, take a quick look with the ultrasound, then they can say, "Oh no, you're fine," go lay
Right,
down.
right.
Or maybe we need to medevac this person out instead of turning the entire ship around. So,
Yeah,
yeah, pretty cool
that's
stuff.
awesome. You also mentioned some rural areas and at home even. So I
Yeah,
think,
home health. People in the near future will be able to scan their bladder. They might not even see the image. It's kind of like a video game where you place a circle over a dot and then they can see like bladder volume or in the future wearables too, like you can put a patch over the heart and then that can send an image somewhere. So those are kind of in the future, but that's kind of
exciting.
where things are going. It's interesting because back when I started in the commercial world, everyone thought 3D was going to be the next best thing, right? Everyone was
Right.
going to be
Yep.
doing 3D ultrasound, and there is a place for it. But
Absolutely.
then there's areas where it doesn't work so well.
Right.
So the 3D has taken off in some of those spaces, but what's really happened that people really couldn't see forward far enough to see was the miniaturization, putting an ultrasound in your pocket or having an AI tool, which is going to do all your cardiac measurements for you or all your OB measurements or count B lines in the lung. So we're really seeing, a lot of advancements that nobody saw 15, 20 years ago.
Yeah, it's interesting. When I had my precious little black lab, I would go to dog parks and I was in a dog park with him once and was sitting around with a bunch of other dog owners like we do when we're at a dog park. And one of the guys was an orthopedic surgeon
Okay.
and he just swore by those handheld things. He just
Yeah.
loved it. You know, we're in a more rural area at this point in time where I was at, and he went to a lot of high school football, basketball games, and he said, it's great. Yep, it's fractured, but the artery is still intact, or there's no real emergency. I mean, he still has blood flow to his foot, so
Mhm.
it doesn't become as much of an emergency because he has that handheld right there that he can just do. And so it really makes a world of difference.
Yeah. And, a lot of people want to compare them to the radiology systems, like the features and the image quality in that. And really, it's not about that. It's about answering the yes or no question. Do they have an aortic aneurysm? Yes or no? Do they have fluid in their lungs that's not supposed to be there? Yes or no? And that changes course of care. So that's really,
Absolutely.
scan someone for 10 seconds. You've answered a question which otherwise maybe they would have gone and had a CT scan done and spent that much money and that much time that it could have been answered and avoided. So, yeah, it's exciting.
Yeah, it is exciting. I love that I get to see, I've been in the field for so long, I get to see the change, right? I love the fact that I'm able to see new technology come out and people push against it and then they embrace it, right?
Yeah,
So I think um that's just to be expected, right? Like,
for sure.
and then embrace, right? When
Yeah, it was probably,
we can get our egos out of the way, right? When we
yeah,
can get our egos out of the way and we realize what their benefits are, but what their limitations are, right? And what our benefits are and what our limitations are, right? So,
Yeah, I remember in the late 90s, the Sono CT came out, or the spatial compounding, and radiologists were like, oh, no way, that blurs it too much. And then once they finally figured out they weren't losing detail and definition, they would never scan without it anymore, you know? So,
absolutely. Yeah.
yeah, it's got to educate people.
Yeah. I think that's exciting. So, in other words, there's just a whole bunch of specialties then that use it, right?
Mhm.
I remember being called down to the ER a couple times when it was first kind of coming out and them asking for help with it. You know, what am I seeing or what am I doing or can you help me with this? And
Yeah.
kind of troubleshooting with them. And it was fun. And but it was used in so many like situations, family practice, cardiology, like you said, sports medicine, rheumatology, orthopedics. So it's definitely something, um, I've done a few mission trips and I can
Hmm.
definitely see where it would have been really hugely helpful to be able to see,
Yeah.
things in that regard. So, tell us about the equipment that someone might need if they're gonna purchase or want to be interested in something like this.
So for handheld ultrasound, typically you just need an Apple phone or tablet. Some will work on Android. Some systems out there, there's a handful of companies, and if it's wireless, it's probably going to work on both. Some have the reliability on the device to have the battery to power the probe, where most of the ones that I've used, they have their own battery, and then you either use a wire or a wireless connection. So Android or Apple tablet or phone, which is nice depending on the setting. The nice thing about the phone is you can hold it in your hand and run the whole thing with your thumb, basically, while you're scanning with the other hand. If you have a tablet, of course, it's bigger, but you need now somewhere to set it because you can't run a tablet with your thumb. So it kind of depends on the situation and where you're at.
Yeah,
And I've seen some now, they start putting them on a pole or some sort of a stand, and it's like, well, now this isn't a pocket ultrasound anymore, which is okay.
right,
Um, those don't walk away as easy in a hospital either if they're attached to something.
right, right, exactly,
Yeah.
right. Yeah, I've seen them work on a phone. Can you talk about the benefits of wireless? Does that work as well, or do you get interruptions with that more often than connect? Or
That's an interesting topic because you may get a delay in image quality, or not image quality, but like real time image. I don't feel like the product that I'm using now has that delay,
Mhm.
but I know there's some, and the physicians, especially if they're doing a needle procedure and the needle is not where it is in real life, that's not fun. But so many people, they don't want the cord. Like, I worked for a company and it did have the cord, and the benefits of the cord were great. Like, the amount of data that could be transferred in a period of time, or heat generation within the probe itself, was lower with the cable. And the cable was like 6 feet. You can't run your phone if it's longer than that and you're further away, but it's
Right,
just the hassle of having it. It's kind of like our headphones. Like, so many people are getting rid of the headphones that have the cords on them now. But with wireless, there is a little bit more of a time it takes to turn it on and connect. Just like anything else, you have to connect wirelessly versus just plug the cord in, you're ready to go. But people really do like the benefit of not being tethered to the device. So,
right.
and some have removable batteries. If your battery dies, you can put on a backup battery, and others, when the battery dies, you have to stop and lay it on a charger and let it charge up, and you can't use it, of course, while it's charging. So there's so many different ones. They all have different features, and just whichever one best fit your needs, really.
So when we're talking about it being hooked up to your phone, then does it use a lot of your battery of your phone or memory? Like if you're transferring images, is it storing to the phone and then transferring to the mainframe, or how does
Yeah,
that
so
work?
typically they will store to the device and then you send them off somewhere else and then you can
Okay,
delete them off your device. But as far as functionality goes, like the phones nowadays, like can easily support running these because it's there is the hardware piece, but the functionality inside the app is pretty strong. And if there's updates to the user interface or a new preset or something, it's just updated through the app. You just update it through the App Store. And sometimes there's a hardware update, meaning a firmware, like you can't change the parts, of course, but
right,
probably a few times a year, all these probes will get some sort of a firmware update and it increases image quality or it increases scan time on the battery, something like that. So yeah, pretty nice. You don't get that with a console-based system typically. You have to pay for an upgrade and they have
right.
to come in and install it and things like that. So, yeah, it's pretty nice.
Are batteries expensive? Like, could they have a backup battery or?
So, I only know of one that you can have an external backup battery. All
Okay.
the rest of them are internally. And most of those probes are warranted for 3 years. So if the battery goes bad for some reason, they give you a new probe. After the 3 years, they just suspect that it's going to be old technology and you should buy a new one. So,
Okay. Good to know. Good to know.
yeah, which is probably true, but sometimes you can squeeze a little bit more time out of a device than 3 years.
Yes, I thoroughly understand that as we work in hospitals who milk technology for a long.
Yeah. Well, they kind of look at it as your phone. Most people are getting rid of their phone every couple of years. And so you would do the same with your
And they
ultrasound, I
force
guess.
you, right? They force you.
Yeah.
But the hospitals aren't so excited about switching out technology so
Yeah.
frequently.
Yeah.
That's a big major um process, that's for
Yeah.
sure. So, what do you feel like the future of point of care ultrasound is going to look like? Will that be
I
part of
think
our
it's,
education? Will that be part of, like, I know a lot of medical students use them now, right?
yeah, for
Now,
sure. For sure.
are,
I think we'll start seeing more and more medical schools implementing the ultrasound into their curriculums. I think we'll see either grants or building the cost of the ultrasound into the curriculum so then everyone gets one. They have it during their whole, education process. And then they go on and they can use ultrasound in their practice, whatever that is. And I think it's everybody is going to have that. I think you'll start seeing larger groups like um, maybe like work comp groups being able to use the ultrasound for certain things. Or I think in the future, you might see like a Walgreens or a CVS Minute clinics having these. Of course, there needs to be training, and the people using them need to be, qualified and whatnot. But I
which
think
has
that
kind
you'll
of
start
always
seeing them in
been
these.
the question, right? Always
Yeah,
been the question.
yeah.
The end
Point of care, though, like if you're looking for some consolidation in the lung, you can teach somebody pretty quickly and then they can, pretty accurately use it. Or home health nurses, like, big hospital systems that have a lot of home health nurses, they can be trained pretty easily to do vascular access if they know that they have a hard stick on a patient because they're doing it all the time. Ultrasound can definitely help. Or, like I said, the bladder or lung ultrasound, pretty easy to learn. Yeah.
Yeah, when it's used for that specific issue, right?
Yeah.
Yeah, I
I also
remember. Yeah,
I was going to say, I also think AI is going to be a huge part of point of care ultrasound in the future. Like, as long as it can give us accurate feedback, and maybe that's, this person have X number of obstruction in their carotid artery, or um, some numerical feedback from cardiac scan, something like that, where it's doing the measurement automatically and kind of taking some of the error out of it, but also maybe doing some measurements to give some data that we wouldn't normally want to do on our own because it takes too long and it's variable between different people. So I think we'll see those things a lot.
yeah, and the key there is just education and knowing how to get the best picture to get the best measurement, right? Like
hmm
that's
And
gonna
some of these tools now are guiding you to get the best image. So let's
be
use
good.
cardiac again as an example. If you don't know how to do it, there's tools out there where it shows you where to put the probe, and then it gives you like a gauge that tells you, yes, your image is getting better or it's getting worse. And it will even give you a suggestion on how to move to get a better image. It's pretty cool. It's pretty cool.
Awesome. That's amazing.
Yeah.
Awesome. Yeah. Um, I wonder how, yeah, that'll be exciting. If we can teach students ultrasound at home with it, right? I
Yeah.
think that'll be another exciting step, right?
Yeah. I think some of the idea from that was if, let's use the ICU, for example, and a patient is failing in a certain direction, and the cardiologist can ask the nurse, hey, can you go scan this patient? Well, she doesn't know how to do it, but using that technology, it could guide her exactly to the right spot, and then she could get that echo image that he needed to see, something like
Yeah,
that.
that's awesome. So just to kind of review, I guess, a little bit of the benefits of handheld is that it's portable, it's small, can be battery operated or used Wi-Fi. Some batteries are built in and some are removable. We
Yeah.
mentioned wireless and this use of the smartphone app, right? And so
hmm
you also meant, well, we didn't really talk about this much, but you're mentioning in your outline here is that it's affordable.
Yeah.
So what kind of price point are we talking about in regard to these kind of?
I think most of them are typically under 5,000.
Okay.
Some have like a subscription-based model where you pay monthly and then you get a lot of services and updates and things. And then there's others where you just buy the probe and then you get the updates over the air, and those are included. And then some are kind of a mix of both. If you want this feature, you can pay a subscription, but you don't have to, pay the full subscription for everything if you don't want to. So we're seeing different models. I mean, we're seeing those with cars now. Oh, you want heated seats? You got to pay every month for that.
Right. Like you want
But
a video, you got to pay extra, right? Uh,
yeah, I mean,
that's
if you look at like a laptop type system, you'll pay, 20,000 and up. So I think to be able to have an ultrasound in your pocket and take it anywhere, I mean, think about all the global places that have never had access to imaging that could possibly now, be able to scan the pregnant mothers and maybe save a life or make some predictions
right.
for when it comes time to give birth. And lots of different areas outside the country that can be helpful.
Yeah, I was thinking of one of my other guests that I had on an earlier podcast where he really did go into other countries and talked about the need to have ultrasound in the other countries. And that ultrasound there are no ultrasound techs, right? So we need
Yeah.
education of the physicians and what a great tool they could use to start with, right? To get familiar and get help with some of that training.
Yeah, there's been a lot of donations from different companies and different groups and different grants for handheld ultrasounds to go places like Kenya, Uganda, South Africa, and really help those people. So that's great to be able to provide imaging to these areas where really they've not had imaging before. And, maybe they might have an X-ray, but you have to travel to get that done. So
Yeah,
someone shows up with an ultrasound in their pocket, you can make a huge difference in that community.
absolutely. Absolutely. So if someone was interested in purchasing, what are some ways in which they can go about making this purchase?
Usually you can buy one off of one of the websites. I mean, you can type in handheld ultrasound and all the companies come up. Everybody pays for marketing.
Right,
But either so that would be the e-commerce route. But there's a lot of times where, let's say, you're part of some sort of a society, a physician society, and they have a conference, and then we would attend, and then they could meet us and then purchase directly from us. Or if a hospital system wants to buy a number of them and they need some sort of integration to their system, then, we would become directly involved then. And then outside the US, we work with distributors. All the companies typically work with distributors, and then we sell through them.
awesome. Yeah, I'm excited to see where this has come and
Mhm.
how helpful it has been, and then to see and hear what you have to say as far as the improvements of it, where AI is
Yeah,
helping you be able to, someone not trained, able to get the image that they're needing with some direction from AI and things such as that, that makes it feel a little more safe to those of us who are trained in the field.
yeah, yeah,
Giving to someone who isn't as trained as a OB ultrasound sonographer, I hear some really crazy things about, labor and delivery nurses, having some fun, or ER nurses, ED nurses having fun on some downtime with the ultrasound machine, and a friend who's pregnant, and then all of a sudden there's some mayhem going on and she needs to be
yeah,
seen away, right? So
yeah.
there's still some of that going on, but um
Yeah, I remember being called in the middle of the night for something you would feel was silly. And you get in there and you scan, it's like, okay, everything's fine, but you never know.
right,
But if that ER physician had even a handheld ultrasound probe, they could put it down, they could say, okay, the heart rate is normal, the baby's moving, the fluid is normal, and they
right.
could kind of avoid all of that, maybe at least until the morning time comes or something.
So talk to me
Yeah,
about the depth of it, because some of these things that you've mentioned sound like they're pretty superficial, right? If you're looking at fluid in the lungs, you're scanning through their back, or you're looking at an artery, or in the foot or the leg, or something, sometimes the heart, which is a little bit more anterior. So
yeah,
when we're talking about a larger population, what's the depth of
yeah.
perception?
Usually so it's either a phased or a curved array for deep imaging. And just like traditional ultrasound, 1 to 5 megahertz on these probes. And they're made to be multi-frequency, right? So they're
Right,
flexible.
right.
So in the abdomen, 25 centimeters, obstetrics, 25 centimeters, cardiac, usually around 16 to 20. So they do scan deep, if
Okay.
needed,
Okay.
and then shallow for musculoskeletal or vascular access and things like that. So that's the great thing about having a probe that's flexible enough to be able to scan the whole body. So you don't necessarily need two different probes. So those are great too. But that when you
Right.
have the two different probes or maybe three different probes, those are specialized. And typically those images are starting to rival the console systems. Whereas like the whole body imaging, Really not designed to do that, to be compared to a console system, but they're still good. They're still really good.
What would you say would be some of the limitations of it then?
Um, Maybe environment. Can you get the patient to a place where you can scan them adequately? Um, or heat, if it's like the desert and it's 120 degrees, the probe might be limited in that aspect. But really, outside of that, I mean, they work really well, very surprisingly well.
Awesome. Well, thank you for sharing all your information in regard to
Of
this
course.
air and how far it's come and where it might be going and where it is going, and how exciting to be able to share it with other countries as I,
Yeah, I love that part of it.
yeah, in other countries and seeing the dire need of something, anything, right?
Hmm.
To help
What's
the,
really cool is going to a conference or something, whether it be in the US or outside the US, and coming in contact with someone that's never seen this technology before, and you turn it on and you scan something and their jaw just drops like they can't believe it. Like it's
right.
really cool.
Yeah. Yeah, it's fun. It's fun to make a difference. It's fun to give opportunity. And I'm grateful for this new technology, even though I think at first when it came out way back in the day, we were all kind of threatened by it. But uh,
Yeah.
I'm grateful it's come so far and we can
Yep.
it so far. And I appreciate the fact that there's no registry that you have to take in order to operate this, right? A lot of times new technology causes you to need a lot more training and sometimes causes you another uh registry to take, at least in the OB world, right? Maybe not now.
Yeah. Now the Intellios group, they have created a point of care certification. So,
Yes.
you can go through that. It does help with reimbursement and things like that in the hospital. So, yeah, there are definitely some curriculums and courses and tests that you can pass, but
Yeah, and
mainly
I
for
highly
physicians.
recommend that. I do really highly recommend that. I think it's very well put together in Telios. They do a great job putting those things together. Uh, and education for training for, people who are not um ultrasound technologists or
Hmm.
providers like
Yeah.
PAs or medical students or midwives or, you know,
So there's some accountability and
right.
education involved.
Necessarily accountability. You just feel more confident about what you're doing, right? And
Yeah.
intelligent about what kind of technology you're using. Like we said earlier, it certainly can set a few red flags if you don't know what you're looking at or how to use
Hmm.
it or the disease process. So there's a little bit more to it than just being able to put the probe in the right place. You have to be able to interpret what you're looking at as well, right?
Exactly. Exactly.
So, I highly recommend that training and certification is always a good thing, right?
For sure, for sure.
So yeah, that's another point of opportunity that you guys, people who have the handheld can obtain and use to help deepen their knowledge of that area.
Yeah. And it's fun to help those people learn too. I mean, I've worked with a few of the professional sports teams, lots of college sports teams, and um, I was surprised to learn that all these sports teams, physicians and physical therapists and trainers, they all know each other. So it's a
Oh
small
yeah,
community. So when one
yeah,
gets involved with it, then they're like, hey, what's this guy doing? And now they're going to do it. So
right,
that's pretty
right.
fun. And I've worked with, special operations, Navy SEALs, and things like that. And they're super excited about this type of technology. So, because they have to carry everything with them,
Right.
but if they can carry something that can save someone's life, they'll bring it.
Yeah, absolutely. In that area. Absolutely. Yeah. Saving a life is what it comes down to with a point of
Mm-hmm.
care, I think. It's like
Yeah,
you said earlier, the yes or no questions, right?
exactly.
Well, thanks again, Chad. We appreciate your expertise,
Thank you.
knowledge, and sharing that with us. I hope that this is helpful to those who are listening and it can help persuade you to go one way or the other as far as getting it or not getting it. Um, I hope that it becomes more available to all. I think it's a
Getting
great
there.
educational tool. I think it's a life-saving tool. I think, like you had mentioned earlier, even in the ED, if they can just take a quick look, right? That saves somebody from having to come in, which keeps from or saves from burnout, saves money to the hospital. It just answers and solves so many questions for us.
Yeah, it definitely increases patient throughput. Like some of these patients that they might have admitted and watched the handheld or the point of care ultrasound specifically can decrease that. Say, well, doing this ultrasound now, this patient can go home or something similar, or
Right,
go have this surgery instead of doing a bunch of tests.
right, right. I
So
agree.
yeah, definitely a money saver.
Absolutely. Absolutely. Thanks again. We appreciate your input.
You're welcome. It was a pleasure. Thank you.
Thank you for tuning in to It's All About the Frequency podcast. I hope you enjoyed today's episode. Share it with a friend and remember to keep your frequency high.